Hey everyone, welcome back. Today, we're diving into something that really deserves more attention: the conditions that are often confused with Hard Flaccid Syndrome, or HFS. And trust me, it's not just patients who get confused, doctors do too. Now, before we go further, I'd love for you to be part of this discussion, so drop your thoughts, questions, or even your own experience in the comments below. So, why is HFS such a confusing condition, even for trained professionals? Well, here's the deal: Hard Flaccid Syndrome isn't actually a recognized medical diagnosis. You won't find it in most textbooks, and many doctors have never even heard of it during their years in medical school. To make things even trickier, HFS symptoms tend to overlap with several other medically recognized conditions. That overlap? It creates a diagnostic gray zone where patients feel lost and doctors often feel stuck. So in today's video, we're going to compare HFS with a few conditions it's often mistaken for or that can exist alongside it. Let's start by laying out the basics of HFS, its symptoms, features, and how people usually approach treatment. Hard Flaccid Syndrome, or HFS, key symptoms include a flaccid penis that feels semi-engorged, numbness, pelvic floor tension, erectile dysfunction, burning sensations, and anxiety. It is often triggered by trauma, has a history of excessive masturbation, and prolonged pelvic tension. Treatment usually focuses on pelvic floor relaxation, nervous system regulation, and psychological support. Next, dorsal penile nerve entrapment. Key symptoms are numbness, tingling in the penis, and pain during erections. It is caused by localized nerve compression, often from direct trauma or injury. Treatment involves nerve decompression, rest, and anti-inflammatory medications. Then, venous leak or veno-occlusive dysfunction. Symptoms include trouble maintaining an erection even with arousal. It's characterized by blood draining too quickly from the penis and is usually confirmed through Doppler ultrasound. Treatment options range from medical to surgical, including implants or vein ligation. Psychogenic erectile dysfunction presents with ED without physical signs, performance anxiety, and a normal physical examination. No pain or sensory changes occur, and mental health plays a big role. Treatment typically involves psychotherapy, cognitive behavioral therapy, and lifestyle or stress management. Lastly, chronic pelvic pain syndrome, or CPPS. Symptoms include pelvic, perineal, or genital pain, urinary issues, and symptoms that flare with stress. It involves widespread discomfort, less focus on erectile function, and is often painful. Treatment includes pelvic pain therapy, antibiotics if bacterial, and multidisciplinary care. So there you have it. 5 conditions, each with overlapping features, yet very different underlying causes and treatments. And that's why HFS can be so misunderstood even by professionals. If you're struggling with a diagnosis, remember, you're not alone. It's okay to seek multiple opinions. And hey, let's keep this conversation going. Have you been misdiagnosed? Did any of these conditions resonate with you more than others? Drop a comment, share your story, and don't forget to like and subscribe if this helped you feel a bit more seen. I've put together a detailed guide designed to help you move out of the confusion and onto a clearer path toward recovery from Hard Flaccid Syndrome. If you're ready to take that next step, you'll find the link in the description.